So different form, different system. So you have lung system, you have kidney system. You see the anxiety, which system is touched. General anxiety maybe just, we have one student, we say in the Yosan, we have Yosan graduate here. He has the tightening on the abdomen here. Since he entered, before he entered university, we treated him several times. But later, just feel one location here very tight. Nothing inside, no ulceration. When stress more, here more tight. So we just treat him, and he also sometimes goes back to clinic, repeat the treatment until the graduate. Normally here feel much better. That kind of stagnation, dismissed a lot. Why? Because make a pattern. The body feel that way, it goes here. You feel that way, it goes here, until make very tightness. Maybe in the future you don't do the treatment, they can develop real stomach trouble, not just gastritis or something. They can be develop ulcerations or Crohn's disease, even more bad situation. That's energy. So that's the systems digestion. And someone developed kidney troubles, right? Or infertility. Why infertility? Stagnation. Your body healthy, everything's okay, but infertility, no reason. Hormones normal. Doctor doesn't know. So go to our medicine, stress, frustration, worry, anger, bloating, gassy. And what's the trigger when the qi moving? When the qi starts strange, all the frequency, the smooth muscles, all the muscles, tones, they're changing. They're not properly, the frequency is destroyed. Our body frequency harmonize together. I don't know, that's called the qi or something else. Some say, okay, that's the manifestation of the qi power, actually. That's true. Because your frequency changing, they causing cramping. More changing, abnormally release hormones. Or abnormally touch the certain organs, the ovulation, everything can be strange. So that's why we have infertility. So okay, this time clear, liver qi stagnation. We give Su liver qi, Su qi herbs. When the qi break out, how to feel? The frequency, the cramping decreasing, pain is better. The normal frequency recovered. So that's why I release the eggs, they catch it, sent from the fallopian tubes. It smoothly happen. The uterine frequency also not so deviated, abnormal. Everything's normal. Absolutely, you can be pregnant, right? The male, the same thing. You have a lot of stress, you hold the stress, low sexual, low libido. Why? Stagnation. You worry too much the future financial company. How can you relax yourself? Make organ frequency better, maintain the sexual power. No way, because worry too much. So that's the trouble. Also easy exhaust the body fast because you worry. The body not harmonized. No. So everything related, anxiety in our clinic. The picture is very clear, very clear. So we see the different patterns, we're talking about maybe show the different, not just a physical pattern, also they have the certain called cycles. We touch somewhere a little bit. Everyone has anxiety to make a pattern. Also sometimes the patient tries to find a solution by themselves to help their anxiety. The problem is later repeat, patternize it. Make the pattern very clearly, that's the bad cycle. So that's a problem. So that's we mentioned here. For example, the eating disorder, anxiety, they go to kitchen, try to find a cake, a sweet to eat. So in general, because they know that, right? So the behavior drive by this kind of anxiety. We call the emotion drive decision making. So in regular time, she understands, I have to go to store. Wow, the cake you paid $15 buy two. Okay, buy one, get one. Someone, the ice cream is good, $5 for 2 boxes. Before it's $8 one, right now 5 you buy 2. Okay, Rob's go to Robertson. Okay, 2. They prepared for you put it in the refrigerator because they know someday when the anxiety comes, they use it. But not someday, tonight, feel lonely, anxiety, crying, open that, hold that jar, eating. Until, give up. But the whole jar finish, or big cake to piece finish. So that's a repeat that pattern. That's why we try to break out the pattern. Use different activity. Instead, you go to shopping to buy this kind of stuff. You let the patient write down the journal, we call it. For anxiety patient, let them write down the journal. If the behavior, lifestyle, something not disorganized, write down the journal to see what they do. Later, they understand. You see, 1 week, bring the journal to you. You do discussion, say, wow, every night you eat sweet. she or he can recall, oh my God, I eat every day? Yeah. Because emotion driving, sometimes they cannot reveal themselves well.